Hello, everyone, and welcome to today's NICHE Virtual Business Meeting 2014. With no further ado, I'd like to hand the floor over to Barbara Broccoli, Executive Director of NICHE. Barbara, if you're ready, it's all yours.
Thank you, Teresa. Hello, everyone. I'm so happy to be here. Thank you for joining us today. I'm here with Linda Bubb, our Director of Education and Programs, and Beth Gray, who leads our marketing and communications. And we have various other NICHE team members on the phone. We thank you again for being at our second annual State of NICHE meeting, and we're very excited to report to you on what's been happening this past year and our plans for the future. And thank you all for participating in the survey that we conducted of all our membership over the summer. Once again, we had very valuable feedback and insight from our entire membership, and Linda Bubb will be telling you all about that in a few minutes. So at NICHE, you are the leaders in addressing needs of older adults, and we here provide the structure and the tools and resources to help you all to develop and implement improvement in the care of older adults. Oops, I'm jumping ahead here. And so just a little bit about our history. Most of you are familiar with the history of NICHE. I'm not going to go through the entire history, but we started in 1981 when Terry Fulmer, one of the founders of NICHE, piloted the GRM model at Beth Israel Hospital. In 1992, NICHE eventually came to NYU College of Nursing, and in 1999, the first toolkit was developed. And it wasn't really until 2007 that we had the funding and the infrastructure to really expand the program and develop a comprehensive portfolio of tools and resources to serve our membership. So 2009, we launched our online training and the online leadership program. And as many of you know, in 2013, we reached over 500 hospitals. And here we are today in 2014. We're in over 575, about 580 hospitals and healthcare organizations, and we're also expanding globally. And you all know what the need is and why we do this. Obviously, I certainly wouldn't preach to the choir, but I will just for a minute. So older adults are hospitalized at 3 times the rate of the general population. They make up 63% of healthcare. They account for 63% of healthcare spending. You know that chronic diseases accounts for 75% of spending as well. And so, you know, this problem is growing. I don't want to call it a problem necessarily, but our population, the population of older adults, is growing rapidly, and we are successfully meeting those challenges, which will impact healthcare worldwide and for every population. You cannot address and reform healthcare in this country and in many other places around the world without addressing the needs of the older adult population. And just going back to our numbers, we show this graphic a lot because I just think it looks terrific and really illustrates who we are. We are, again, in over 580 hospitals and healthcare organizations in the United States, including we just brought on our first site in Alaska. If you look at the next slide and you look at what we look like, how we are globally, we are in Bermuda, we are in Singapore, we have 2 hospitals in Singapore, and we just finished an assessment commissioned by the Mexican government to possibly adapt NICHE to the hospitals in Mexico. So we're expanding globally, and we're also expanding across the continuum of care, as is absolutely necessary in today's healthcare environment. And we have just a little bit about who's engaged in NICHE, some of those numbers. Since we launched the online leadership training program, over 1,600 individuals have participated in that online designation process, and prior to that, over 1,200 participated in the designation process when we did that in a conference-based format. we have over 35,000 users in our Knowledge Center, and overall there's 2,876 LTP alumni. And you've really embraced, we have to say the niche community has really embraced the online learning and at the same time has continued to turn out in huge numbers at our annual conference, which is that one time a year that we all get to come together face to face. Membership growth, just another illustration. Oops, sorry, this is a little sensitive. It's jumping ahead. We, in 2007, were just below 200 sites, and now in 2014, again, I'm going to say that number, 580 hospitals and healthcare organizations. And on this slide, the purple are the hospitals, and the orange are associate members. Those are skilled nursing facilities, home health, subacute and post-acute sites that are coming on as associates. And Linda will tell you a little bit more about the program that we're developing outside of the hospital that we'll be launching next year. And then our conference numbers, again, because we do really value this experience every year when we have our members meet in one city. We have steadily grown. Last year, we dropped a little bit, but that was our first ever West Coast conference. So we went from about 180 people at our conference in 2007. In 2013, we had to shut our registration down after 750 people registered because we could not fit in the hotel. And last year was the first conference ever that we held on the West Coast. So we didn't quite have the same turnout as we do here on the East Coast, but we were thrilled about having 650 faces and lots of new faces too. So we do plan on returning to the West Coast. And also the number of non-members that attend our conference has grown increasingly. On this bar chart, the purple are niche members, the orange is are the non-member sites or individuals, and we love to reach out to people who are not yet part of niche, and we engage them and recruit them and get them on board. And just a little bit on our upcoming conferences. In April of next year, we'll be in Disney at the Swan and the Dolphin Hotel. Following that, we'll be in Chicago and lots of other great places coming up. And these are all listed on our website. So you can look at our conference site, and conference registration will open on Monday, so you will be able to register for our next conference. Okay. And so now we're going to turn it over to Linda, and she's going to tell you about our site levels and survey results.
Can you?
Yeah.
We have to rearrange a little bit here. Hi, everybody. It's Linda Bubb, Director of Education and Program Development. So I'm going to talk to you a little bit about, for some of you who have been through the process of filling out your survey and then going through an audit. So I'm going to talk a little bit about that. So these are the current levels of implementation. As you can see, most of our sites are at that progressive stage. So with the progressive, you've got at least one GRN unit. You have a steering committee and a vision statement. You are starting to build some interdisciplinary capacity. You're working on engaging your staff. And this is where most of our sites are because we've grown so quickly. These are usually sites who are in their first, second, third year. And then you can see we also have a good chunk, a third of our folks are senior friendly, and we're certainly growing that exemplar number. So we've grown that from last year as well. We're steadily increasing how many exemplar sites that we have. These are our current exemplar sites, and I know for the folks who had an audit call with me last week, we have 3 new ones that we didn't get a chance to add to this site. The University of Wisconsin Hospital and Clinics, Henrico Doctors Hospital, Retreat Campus, and Shands at University of Florida. So congratulations to all the exemplar sites. And I'll talk about the audit process and what we ended up seeing with some of these exemplar sites and the consistency around these programs. So again, this is the annual survey and program evaluation. These are the kind of the bullet points or the main points that you'll see with these different levels of implementation. I thank all the sites who've done their yearly diligence of handing in your membership profile and your program evaluation. We wanted to have a slide just to remind you again about what the different levels of implementation look like. We've had some changes. If you took your survey this month in September, we've made a few adjustments to make it a little bit easier to answer, reworded the answers for you so that you really had an idea of how to measure your program and the growth that you've had over the time you've been with NICHE. And so we really wanted to make sure that we're able to measure how well you've embedded the NICHE program or geriatric programming at your facility. So this is just a review. Again, this is on the main website for you to take a look at, but we certainly want to make sure that we have all of these resources for you. So it looks like we did miss one. Thanks, Brenda, for sending us a little message. St. John's Hospital and Medical Center also achieved exemplars, so I'm sorry that we missed that on the page with the exemplars. So starting, for any of you who've gone through the audit process, you heard my spiel that starting in January 2014, we started an audit process. Emma Hutchinson and I were working on that in the fall of last year, setting up criteria for those audit calls. So any site that meet the criteria that you see, those three areas, so any early adopters, a score of between 1 and 10. Again, the max score is 49. There are 49 questions in the program evaluation. If you had a change of 10 or more points, either positive or dropped in 1 year, you would be pulled for an audit. And then again, any new exemplar. So we want to make sure that we have the opportunity to, first of all, hear your successes and how you were able to increase, if you had that 10 or more points of increase in 1 year, how you became an exemplar. And we started off January of last year by auditing all of the exemplars from the September group from the year before, and then started putting into place some of the criteria that you see on the slide. So at this point, a total of 104 sites have been audited since January. And typically it's about an hour call. And what we found with that is there is consistency around those bullet points that were on the previous slide. And some other things that came out, I'm able to share specific implementation tools that sites are using, how they have their GRNs working at their facility. And I've been able to share that with all the sites that I have an audit call with, especially other exemplars who want to know what the other exemplar sites are doing. So it's a great opportunity to share best practice and what you're doing with your NICHE programs. So again, thank you to all who answered the call for the survey this summer. We have some results that we can share with you. At this point, just under 2,400 folks filled out the survey from over 225 facilities. The roles, again, we had a high population of staff nurses, GRNs. We had some advanced practice nurses, but again, really the staff nurse and GRNs were our biggest responders for the survey. And we found out that 62% of the folks who answered the survey are a part of some sort of integrated health system, which certainly reflects where healthcare is going today. Again, this is a graph of where folks were coming from when they filled out the survey. So we had a big jump in physician offices, which is exciting. So maybe that can give us a clue of some additional resources that maybe we have to build in the future. But the majority of folks were from acute care, or that they have these resources, or this is part of their integrated system. You have inpatient rehab, home health, long-term care, assisted living and group home, and then other. But the majority of our folks certainly have acute care or hospitals as the driver of their system. these are some of the requested focus areas. So we had lots of requests, but these are the top information that folks are looking for. We have our highest one is geropsych, and we had certainly palliative care, dementia, medications. So we certainly have a lot of resources that we should be building to meet the need and the demand that you have in these care areas. You know, I think that certainly in moving forward, we're trying to collaborate with other nursing organizations and other organizations to help provide these resources for you. We're looking at dementia and delirium or cognitive impairment for our conference. We were just looking at podium speakers today, so certainly understanding the need, especially since, as you all know, as clinicians, those dementia patients are barely hanging on at home. They have some kind of clinical event, and that's when you see it, especially in the hospital. And so how do you then deal with those? I was just having that conversation with Suzanne Purvis last week about how do you meet the need of those dementia patients when they present to you and the family is unaware of their dementia. So we surveyed you to see what resources you're using the most of from your niche, the Knowledge Center, and right now the courses are the top ones. So certainly the GRN, the GPCA. Webinars was very popular, and we hear that. It's often an answer for that continuing credit for your GRNs. I was very excited to see that education briefs were certainly number 3. The need to knows, which I think are growing in popularity because they're a resource that if you have CRAMES or some of the other education resources, they might not have geriatric specific education. So those need to knows are certainly a good option for you. And we've expanded what we've been able to offer. I have my subcommittee group, the orthopedic group, where we have 2 need to knows on orthopedics. And we also had those presented at 2 conferences this summer, so thank you, Anita Meehan and her group, for doing that. The specialty courses, and then also the clinical improvement models. And we're looking at updating those this fall, the ones that we have, as well as building new ones for 2015. Sure, I think at this point we're going to take a poll and ask. We're looking at should the need to knows be setting specific, meaning acute care, long-term care, home health, or generic across all settings? So take a little bit of time and answer the question. You can help us as we look to develop new resources. So it's looking like at this point, we're leaning towards setting specific, which certainly some of the resources certainly could be appropriate for any area of care, but having specific resources for long-term care, home health, as well as the acute care setting is certainly a path that we can take moving forward. So then we were looking to find out how do you market your program, which for any coordinator, that's I think one of the toughest parts of the job. I know that was a challenge for me internally, and it looks like right now staff meetings and using the intranet or the website followed by committee meetings are the top ways that you're able to market your program internally. I think having NICHE at certainly talking about your program at senior leadership meeting is definitely important, but at this point, having staff meetings and then having some sort of recognition on your website. A lot of you have the NICHE icon on your internal website or external, but that link with NICHE is a way to get the access to the GAP, to the NICHE website. I know one of our sites has a picture of the coordinator on their internal or their intranet. I won't name names, but I did get a good chuckle. It was awesome to see her picture on that part of her program.
I'm surprised that we're not saying that people are hanging their banners.
Yeah, Barbara just mentioned that she's surprised you're not hanging your banners up there, so maybe that's something you can work on for 2015 is get all your banners out there. So then externally right now, the majority of you answered don't know, and then followed by the facilities website. And I think this is where maybe we can be helpful. We have Carrie Gallagher who can help you as you market your program, myself, Elsie, when you try to figure out how do you get your program out there, certainly celebrating successes. If any of you, oh yeah, and we have Beth and her team for TSI, but really looking at when you have some sort of success, let us know about it, but also let your local paper know about it and really celebrate what you're doing. Make sure that folks know that you're elder friendly, that you're senior friendly, that you're a niche site. Because when you look at the population that you're serving as well as their family members, the boomers, you want to be able to market that this is a safe place, a safe haven for older adults. And we're very good in healthcare at marketing baby friendly and maternity friendly, but we're not so good at the elder friendly. So make sure that if we can help you in any way to figure out how to market, we'd be happy to do that. We do have the media kit in the Knowledge Center, which I've been referring folks to when they're asking for logos or they're asking for other things. If you go in the Knowledge Center and that center green block, click on the Media Center and get familiar with all the resources in there. Beth and her team work diligently with Carrie to get those up this year. They've all been revised and they're beautiful. And there are ways that you can print them out for presentations, for sharing with the public, with internal meetings, things like that. So really look at that media kit. I even had the request for a site, which their site name escapes me, but they wanted to have new niche shirts, and so they had their own logo as well as the niche logo put on them, and someone reached out last week. So any of those resources, I highly encourage you to go review if you haven't. And then looking at the survey, we also had where you could free text and write in additional thoughts or things you wanted us to know about. And these were the three main topic areas when I reviewed it. Certainly looking at education. We did have the request for local training and having conferences and training within your region and at your site. We do have a speakers bureau that Elsie manages. But I really highly encourage you, if you are interested in having someone speak at a local event or at your facility, to reach out to Elsie. If you are interested in being a speaker or doing some work with other niche sites, also reach out to Elsie so we can grow that speakers bureau so that you have the ability to call on us and we can say, oh, this is in your area, so-and-so has offered to be a speaker. Also looking for specific topic areas if you're going to offer yourself either as a speaker or look for having someone speak at your facility. Having additional webinars and growing as well as the topics, and for other venues of care, again, the local speakers. Having more information about designation and reviewing that process. So I've tried to be very open and have the ability to talk about that designation process, as well as having more information at the end of the LTP. Having education for other disciplines. We had some therapists and social workers who requested if we can have information or courses specific for those disciplines. It's certainly something that we can consider. I know that OTs can use nursing credits, but certainly in 2015 and 16 we might be able to explore that. At this point we focus mostly on nursing and CNAs, but certainly something that we can take that feedback. With the coordinators, certainly sharing information between coordinators. And we, at the end of this, I'll have another poll for you that we have an idea for coordinators. Looking at when you have a new coordinator to a site, right now we're encouraging folks to go through the LTP, but we certainly heard the call to have education, maybe a class or some kind of offering for coordinators when they're new to the job for an existing site. There was some requests for blogs and tips, one-on-one mentoring, and I know some of our LTP mentors have offered to do that. Quarterly check-in. The emails were very popular with folks, which I was happy to see, and so was Beth and her team, that emails were popular. And then in the Knowledge Center, having coordinator capabilities. So really, we're working with WebCourseworks, our vendor, to make sure that we have the ability to pull what your users are doing, having accurate transcripts. We're working on that this week, as well as all of those upgrades that we had, especially over Labor Day. That was a big push. The user issues around some of the webinars launching and other things, so we're taking all of that to heart and making sure with our upgrades that we're able to make it a better user experience. When we do our course upgrades, we're making it easier for mobile devices to be used with the Knowledge Center. And then the webinar timing, I just wanted to make sure that folks know, even though the webinar is in the middle of the day, it's archived usually by the end of the week or early the following week, so then you're able to watch it at any time. We pick the middle of the day because sometimes it's easy for folks to get at lunch, but those webinars are archived and then you can watch them at your leisure. So we do have another poll that I'm going to pose now since we're on some of the Knowledge Center. Click on it.
Coordinator's Corner.
Done. Okay. So the poll is live, so take the opportunity to look at the question. Would you use a Coordinator's Corner discussion board so that we could post things for coordinators, specific information, additional resources, and then that you're able to collaborate? Looks like it's, I assumed it was going to be a big yes. It looks like it's, and so we're actually working with our vendor right now to make that available. So thanks, everybody. So I think we can assume that everybody wants this.
Mm-hmm.
All right, so now I think I'm turning it back over to Barbara.
Me. Okay, terrific. You know, I want to create another poll because I like this poll. And my question is, would you want to have regional or local chapters? And I'm going to,
Probably have to do yes or no. Because I know that we did, and if any of you have a local conference, please let us know about it. I know that we had one recently in Connecticut. The Meridian system has one early November. The Aurora system has a conference in Milwaukee, so that we can put it on the discussion board or post it for in our calendar or let folks know. So please, if you have something going on and you have a regional conference or you'd like us, one of us to try to come to something, I know Elsie's going to some of the events out here on the East Coast. Certainly let us know about it, either email myself, Elsie, or Carrie, so we can get those posted for you.
Okay. So that poll is live, the question about regional chapters, and I'm really responding to the survey result that showed that you'd like more local trainings, and we've spent so much time building an online environment that's easy for everyone to access and cost efficient that it was beyond our bandwidth to set up local infrastructure. We're still open to the idea of doing that, and we have long talked about, you know, do we support chapter development? And I know that many of our sites have developed, you know, organically their own niche chapters or groups. So it's definitely something that we should talk about more together in the future. And thank you for responding. So it looks like the majority of you definitely favor that. Okay, so we're just going to talk a little bit more about resources, and I apologize for my voice, but it's I'm losing it, and it's I'm losing my voice and some other things as well. So we are excited about offering you new resources this year, as we always are, and Linda spoke a little bit about some of the new resources, or at least what you're requesting in terms of our survey results. And we know that last year orthopedics was identified as one of the areas to develop for resources. So Linda has done a great deal of work. Did you just talk about this? Okay. Okay. So we've responded to that, and we have a lot happening. and it's very great to get your feedback on the Need to Know series, and we're happy that our hospitals are using those so much. We developed those with the consumer in mind, and we weren't really sure how much the hospital would utilize them. So I also, as I see that many of our integrated systems are now including physician practices, our colleagues at the Hartford Institute for Geriatric Nursing have developed and are piloting a course called PCOA, Primary Care of the Older Adult, and that would be very helpful to physician practices in the U.S. and you can and nurse practitioners, and you can find that on the Hartford website. It's hign.org.
It's also a link if you look in the green block in the middle. Yeah, there's a link for the primary care course that way too.
Right, and the Niche Knowledge Center. Thank you, guys. Okay. So in 2014, you could see that we created, several new resources. We revised the Acute Care G-App. We also launched the Long-Term Care G-App. We have several new organizational strategies, the media and marketing materials, continually producing webinars. We have new solution series and portfolio series, and on and on. And so I'm not going to, go on anymore about all the resources. We're trying to keep you informed, and please stay tuned and look at our website and go onto the Knowledge Center and look at all the new resources, and we'll try to make sure that we're checking in with you to see that you're utilizing them. We also have partnerships with some other organizations, like we supported Emergency Nurses Association in the second version of GENE, so you will find the Geriatric Education Emergency Nurses Education course available at a steep discount to our niche members. So if you go into the Knowledge Center under courses, you will find a link specifically for niche. And we have some new resources coming up soon that are always posted in our newsletter, so you should keep an eye on that and check the homepage of our website. Okay, and so the long-term care expansion, and this is really, Linda's been doing a tremendous amount of work with the committee of content experts, many of whom are probably on this call today. And the curriculum is being revised, the content, for our expansion across the continuum. We actually now have, the GRN is now entered the course development phase, so the content has been developed, and we're now handing that over to the course developers, the technology piece, and then we'll start working on the GPCA and the Intro to Gerontology. With by the end of 2015, all of the 3 existing courses will be revised for the hospital and the long-term care setting, post-acute, subacute, and can also be utilized by home health. We are also working on the designation process for skilled nursing facilities, and we are, if that is not completed by the end of 2015, it will be early in 2016. So we've devoted a lot of resources, have engaged many of you as the content experts, and other members, Holly Brown, who was formerly our practice manager, is now working in a more engaged way as a consultant with Holly and the content expert team. So we're definitely putting the resources towards this and hope to have a much more expansive program. And then I do want to mention that Linda Bob and our colleague, Dr. Allison Squires, spent about 10 days in Mexico in August doing the early assessment of 5 hospitals, and we are now going to start a GAP for those sites, and by December we hope to have a plan in place to do a full adaptation of the NICHE program to Mexico. And this work we're doing with the Institute, the National Institute of Geriatrics in Mexico. They came to us, and they are like our National Institute on Aging in the U.S. They are the National Institute of Geriatrics, and their government has put a lot of, has made a large commitment to improving care of older adults. So we're very excited to be working with them. And just as we talk about our partnerships, we love partnering with other organizations, and we like to bring our membership together with other organizations. We don't want to reinvent the wheel or create new things if someone out there is already doing it really well, which is part of the reason why we collaborated or we turned to Emergency Nurses Association for the geriatric ED education. So we also work closely with AARP on developing tools that will support family caregivers. We just started talking to our friends at the American Geropsychiatry Association, and we're going to collaborate with them on creating some good geropsych resources. And we also are working with the nurses, the Hospital and Palliative Nurse Association to develop some more resources for the palliative care needs of our members and our communities that we serve. And then Linda, of course, works with the ICON group, which is the International Orthopedic Group. And recently we partnered with our colleagues here at NYU on the Oral Health Initiative, and we're co-presenting webinars, a series with them. And just a couple of resources for patients and families. We just started working with a group to develop an app, a NICHE app for our iPhone. For our Need to Know. It will be for an iPhone or Android. And the Need to Know app will also have Find a Niche Hospital built into it with a GPS functionality. So not only will consumers be able to look up a resource that will help them as they are entering into a institutional situation, whether it be a hospital or a nursing home, but they'll also be able to find their nearest niche hospital. And we hope to launch that in April at our conference. And we're piloting, for a couple of years, we've worked with AARP to develop this toolkit for professionals to support the family caregivers in the hospital, and several of our hospitals participated in a pilot developing this in collaboration with our colleagues at AARP. And they finally signed off on a prototype toolkit that we can now start testing in a limited market. So we'll be doing that locally on the tri-state area, and then after we revise it somewhat, we'll share it with the world. But anything that we can do to support patients and the families and in the overall patient-family experience, we're trying to do that. And in terms of research, we have some new publications, and we do post these on our website, but the work that Liz Capizzuti has been doing with Heidi Wald et al. At University of Colorado, they've published yet another article, and we have the link available on our website, and that is one of 3 articles that has been published. We also have, we'll be continuing to do research on the Mexico adaptation, and then we're going to be working with our colleagues at the Hartford Institute here at NYU on a geriatric research consortium, and we're looking at to present a new research agenda for NICHE. We want to finalize the tool that we've really started to develop several years ago, but it's on the cost savings impact. We now want to start to analyze the clinical outcomes, and we need all of you to participate in the unit level survey that's now available from our benchmarking service. So you can provide us with that clinical data on a quarterly basis. You can align it with your GAP benchmarking, but we will also be able to look at it and analyze it. So we need to get more of those clinical outcomes. It will really help us to aggregate data, analyze it, and help to make a case, to prove the impact of NICHE. So we're looking at clinical outcomes, utilization impact. We want to continue to see when you do this organizational, NICHE is an organizational intervention, and how you're utilizing components, what the impact is on your organization. And we also have many colleagues here that are turning to us as well as other countries to use NICHE to develop their workforces. So, sometimes we forget, but, when NICHE was in its very early days, a lot of what we did with our members was to help them develop the entire leadership capacity of nurses in the U.S., it was primarily in the U.S. and then Canada. So it really is a tool for developing nursing leadership. We forget sometimes, how important that nursing leadership. I don't think any of you forget, actually, but we've achieved a high level of leadership in the U.S. for nurses. Other countries that have workforces that are not nearly as developed as ours see NICHE not only as a way for them to improve care of older adults, but to build the leadership of the workforce. And of course, again, we were there too, and we continue to do that, but sometimes we forget. And then we want to do our site level analysis. Like Linda was talking to you about the different levels, and that's important. Marie Boltz published a paper on our very early results when we started to do the annual program evaluation, and now we have so much more data. So we want to work with our colleagues, faculty colleagues here, to start to review some of that. So that's just some of the research that we're looking to advance this year. We also are, from time to time, we receive requests from other researchers who want to engage our NICHE hospitals and NICHE sites in research. So we have a colleague at Mount Sinai School of Medicine, Dr. Will Hung. He's a geriatrician researcher, and he just received a grant from AHRQ to study. He's really looking to study the level of intensity of geriatric models, and he only wants to look at NICHE hospitals and then the GRN model, as well as several other like mobile ACE units and other models, geriatric models will be looked at, and he will be trying to reach out to our hospitals to volunteer to participate in this study. He is not ready to do that yet, but we'll post it in our newsletter, and he might come to our conference in April, where he can also try to engage volunteers to participate in this study. I'm just giving everybody a heads up on that. And then I'm going to turn it back over to Linda. She's going to talk a little bit more about committees.
So these are the subcommittees that I have now. Our most prolific so far has been the orthopedics. We have the 2 need-to-knows on hip fracture and repair, as well as preventing complications from those. And those are now they've gone international, which is the work has been with ICON. So they've been presented in London in June, and in Spain, in September. So we're very excited about that work. We also have the long-term care group, which has done a lot of work. So thank you for all the committee members who put time and effort in revising and updating the GRN modules, all 14 of those. So we're, like Barbara said, we're in the process of working with the developer now to update those. Heart failure with Rebecca Boxer, we're in the final stages of 3 PowerPoints for the subacute setting on managing heart failure in the subacute setting. Stroke, we're looking to revitalize that team. So you might be hearing from me, any of you sites that have certified stroke centers. We want to grow our team a little bit more. The Small Hospital Collaborative, Elsie, is now taken over. We had a webinar or a call last week in December. We're going to have a webinar for the folks talking about resources and best practice, and then we'll begin to develop the systems group. These are some of the responsibility of the subcommittee members. So if I reach out to you in the near future, I will include those when I reach out to you. Okay.
And so we want to thank all of you for being part of NICHE. Just a reminder, on our website, you can find the phone numbers and emails for everyone on our NICHE team here in New York, or not all of us are in New York, but this is our central office, and our contact information is there. We're going to answer questions in a minute, but I just want to also take an opportunity to thank our faculty here at NYU, but most of all, our faculty mentors. Without them, this wouldn't even be possible. They contribute so much to the designation and adoption of NICHE by so many. They're really amazing mentors. And so we also have, so many of you that volunteer as content experts that contribute to this. And then your participation, all of you, on a regular basis, supporting and mentoring each other and coaching each other on the discussion boards, via email, however you connect. It's really what makes NICHE so successful, the collaborative nature. So we have a few questions. Conference registration opens Monday. So we want to see everyone in Disney. It's going to be a great conference. Eric Coleman is one of our keynotes. We have our very own Eileen Sullivan-Marks, Dean of the College of Nursing. Pat Quigley from the VA, who's a falls expert. Mm-hmm. And then wonderful, we are so impressed. We had 200 abstracts submitted, and we have our committee who votes and scores them, and we just spent the morning, Beth, Linda, and I, looking at the final schedule that we're hoping to post. And the work that you are doing and the work that you're presenting at our conference is amazing. Mm-hmm. I think this is by far the best year ever. So it's going to be a fantastic conference.
And I just want to say that we know you're going to want to stay the weekend. The conference ends Friday, so I made sure we have plenty of Friday nights and Saturday nights reserved at the in our hotel block.
Nice.
Okay, so we have several questions coming through. So you have to suffer through my voice for a little bit longer. Lynn Caldron asks, something about NICHE coordinator emails. What are you referring to?
Well, the coordinator email, those would be the newsletters. Certainly they go out to everyone, and I know that LC has started this year doing member engagement. So I think the question that had been posed in the survey was about the amount of emails and the email outreach that has been coming from NICHE. And most of the responses that people typed in were that it was just enough emails, and some had asked for more. So Barbara and I and Elsie were working on yesterday talking about additional outreach for coordinators.
Maybe more explanation on the coordinator corner.
Maybe it was on the coordinator corner. We're looking at having a discussion board or part of the Knowledge Center where it would be just a link for coordinators. So users, your staff wouldn't have access to that, but it would be just for coordinators, that you could post questions to other coordinators. We post resources. Some of the discussion board posting recently has been on spices and embedding that in the electronic health record. So topics that might be more pertinent just to coordinators, we'd have that in that coordinator corner. So we're working with our vendor right now to be able to develop that resource.
Okay. Next question from Jean McKnight. Do you recommend registering for the NICHE conference early? Absolutely. Registration opens on Monday. So the sooner you register, you'll have early bird registration, the discounted rate, but you'll also be able to get your hotel booked and get the lowest rate. And also, Susan Burke asked, when will abstract writers be notified if they were chosen?
We will post them on the 20th. We will be posting just the topics, because we will be sending a series of emails out to podium presenters, roundtable presenters, and poster presenters, and that'll take a couple of weeks, but we will be true to our date that we posted all the abstracts. Everyone will receive an email notification, and then we wait for those to come back before we actually put them up on the website.
But we will start sending out those notifications next week.
The date is, I believe it's everyone's notified by November 1st. Is what we said on our abstract.
Mm-hmm. Within the next couple of weeks.
Yeah.
And someone also asked, will the site coordinators be able to add their own site members in the upcoming year?
I think we're looking at developing that with our vendor, but at this point, in order to, because we ran into some issues with being able to map users with coordinators, so we want to make sure that we have all of your users that you would send to us mapped correctly to you so that you can pull their transcripts and monitor what they're doing. So right now, Nori and I are working on mapping out all of our existing users. Some of our users have multiple accounts to their name because now we have it open that you can create an account, and so we're working on cleaning up the Knowledge Center. So for all the coordinators out there, you might be hearing from us if we haven't reached out to you already to verify your list of users. So we have, at this point, I think we've gone through about 25% of all of our sites, so I think we've hit about 100. But at this point, we want to keep it a closed system so that we can really monitor and make sure that you have the correct users to your account. So at this point, and not right now, certainly something we can develop in the future.
And some more questions coming in. I'm going to try to get through as many of these as I can because we only have a couple of minutes left. Can the coordinators' blog or discussion be open to our administrative assistants? We understand the need. I think we're working on having
having multiple folks assigned as an administrator role or as a coordinator role. So if you have an administrative assistant that you would like to be able to have send in user uploads or communicate with us, certainly let us know.
And be on the discussion board.
Right. Mm-hmm. So work with Nori if you have someone else that you need to be put in for your site as an additional coordinator role, quote unquote, so that we can get those added to the system.
Okay. Wow, there's so many questions here. Just in case which I know we're not going to be able to get through all of these, you can email all your questions to us at
send them to me, Beth@NICHEprogram.org, and I will make sure they get disseminated to the right person and you get an answer right away.
So that's Beth@NICHEprogram.org if we don't get to your question now in the few minutes we have. One question came in. My facility is facing budget cuts. How can I keep our NICHE program continuing? You can contact us and we'll do what we can to support you in making the business case and explaining the value of NICHE. We've helped other hospitals do that. It's hard sometimes to put a number to the value, and we do have some tools that do that, and it is in the scheme of a hospital budget a very low price point. So,
right.
And although the staff time and training that your hospital's investing, of course, can add up to lots of money, but it certainly, in the long run, saves you money. We just don't have that. A lot of evidence right now to show you that, but we do have some very simple metrics that make that case.
So this is Linda, if you email me and or Elsie, we can set up a call with you to walk you through how you could present it to your leadership team. But this would be my call for action, that if any of you have your NDNQI data that you can separate out by age and by your NICHE units, that you can submit that to Joe, and we can get that growing body of evidence that improving the clinical outcomes. But I'm really looking for sites to submit that unit level data. But certainly reach out to Elsie and I, and we at linda.bub@nyu.edu. I'd be happy to set up a call and work that out with you.
And certainly we have hospitals that have outside funders and foundations who support their programs when they're facing these budget cuts too. So, if you don't have the internal funds, you should have your development department or your grant department, whatever they call it at your hospital, working with you on that. And we'll, again, help you do that. So someone asked about recommitment survey. Emma at NICHE-program.org. She is, somebody said they submitted it late. Right. And there's a question about user uploads. We should next year post these on this document, and I'm actually going to open up the team slide again. That might help. Don't be confused. A couple of us have NYU emails, but most of our team, or a lot of our team, just has NICHE-program.org. So if you have user uploads, if you go onto the website, right in the Knowledge Center, it tells you where to mail those.
Right. So if you want to email support at nicheprogram.org, we'd be able to help you through that process. Or if you email Nori, she can certainly help you with the user uploads. For the recommitment or the program evaluation, email Emma or myself. Some of you might be pulled for an audit. So if you haven't heard what your designation level is, reach out to us, but you might have had to schedule an audit call because you met some of that criteria.
Okay. One important question here. Someone asked if we can supply everyone with the questions and answers. Absolutely. We'll put those all together in a document and share it with everyone who attended, and perhaps we can add it to an FAQ on our website. But we will print our hosts here, the webinar provider, Teresa, who kicked off the webinar. I'm hoping, Teresa, you could just cut and paste these so we can save them. But
yes, of course.
Okay. So we will definitely do that. And I think we're going to answer one more question because we had a lot of discussion today. Someone's asking if we could talk a little bit about the format, time frame, and content for the tabletops at the conference.
Okay.
I'm assuming you mean the tabletop presentations.
The poster presentation.
No, I'm wondering if it's the table,
the round table.
The round tables.
Ah.
So assuming that's what you mean, this is the first year we're doing round tables, and Beth, you have 30 seconds to help explain this.
The round tables we have set up with a room, 9 tables, each set for 10. Each will have a different presenter. The presenter will give a brief overview of what their abstract was about, and then it's open for discussion, and that presenter will be facilitating the discussion. We had a discussion this morning whether we were going to do 3 presentations within that 90 minutes or 2, and we're still debating that. So it may be that there'll be an opportunity. There definitely will be an opportunity for those people in the room to get up and hear from someone else, but that may happen twice or it may happen 3 times. Each one of the rooms, we have 3 different roundtable opportunities. One will be on transitions, one will be on cognitive behavior, and one will be on safety. So everyone in that room will be talking about the same main topic, and people will base their selection on that. It also happens they will be on Friday, and that will be the same day that we will have the research workshop. So it'll be an either or, and we're breaking them up into hour-and-a-half segments in the morning, 2, and then an hour-and-a-half in the afternoon. So, and there'll be another thing, during lunch, we're doing box lunch that day so that you can stay in that room and get to talk to somebody you might not have been able to talk to earlier because there was room at that table. So we're trying to accommodate as many conversations one-on-one as possible.
Okay, so I think we're out of time, but we will provide all these questions and answers to everyone who attended. And if you have any other questions, you can send them to Beth at nicheprogram.org, and she'll make sure that we answer them and add them to this list of questions that came up today. So we thank you so much. This will be available archived and recorded. In maybe about a week we'll have it available. It usually takes a few days for us to get it back online. So, Teresa, is there anything else we need to do before we wrap up?
No, I just want to thank everybody for joining us today, and we look forward to seeing you online next time. Have a great day, everyone. The event has now ended.